How does U.S. health insurance work? The United States healthcare insurance system is one of the most complex and multi-layered in the world, reflecting the characteristics of a country that is both highly advanced in medicine and heavily influenced by market-driven principles. Unlike many developed nations that adopt government-managed universal healthcare models, the U.S. relies primarily on private health insurance, complemented by a few public programs to assist vulnerable populations. This creates a diverse insurance landscape, where an individual's access to healthcare services largely depends on their ability to pay, employment status, and legal residency. In the U.S., health insurance is not automatically provided to all citizens but is commonly linked to employment. Many Americans receive insurance through their employers, as companies often offer health coverage as part of their benefits package to attract and retain talent. In this model, employers typically pay the majority of monthly premiums, while employees contribute a smaller portion from their paychecks. Employer-sponsored insurance is generally of high quality with relatively low cost-sharing, but it creates challenges for those who are unemployed, self-employed, or working in sectors without benefits, as they may struggle to obtain adequate healthcare coverage. For individuals who do not receive coverage through employment, they can purchase private insurance through the health insurance marketplace, established by the Affordable Care Act, ACA, commonly known as Obamacare. Enacted in 2010, the ACA aimed to expand health insurance access by offering subsidies, tax credits, to low- and middle-income individuals and prohibiting insurance companies from denying coverage based on pre-existing conditions. The marketplace functions as an online platform where people can compare, select, and purchase insurance plans from private insurers. In addition to private insurance, the federal government operates two major public health insurance programs, Medicare and Medicaid. Medicare serves seniors aged 65 and older, as well as certain younger individuals with disabilities or chronic conditions. It consists of 4 parts, A, B, C, and D, each covering different services, such as hospital care, outpatient visits, private health plans, and prescription drugs. Medicaid, on the other hand, is jointly funded by federal and state governments and is designed for low-income individuals, including children, pregnant women, people with disabilities, and the elderly poor. Each state has the flexibility to expand and customize its Medicaid program based on local needs and budgets, resulting in significant variation in access across states. Healthcare costs in the U.S. are among the highest in the world, making health insurance essential for protecting individuals from financial ruin due to medical bills. However, even insured patients often face additional costs such as co-payments, deductibles, and out-of-pocket maximums. These expenses vary widely depending on the insurance plan, forcing people to carefully balance monthly premium costs against the actual protection the plan provides. Some low-cost insurance plans come with high deductibles, meaning patients must pay large amounts out of pocket before the insurer begins covering expenses. This presents a major obstacle for low- and middle-income Americans when dealing with unexpected illnesses. Although the United States boasts some of the world's most advanced hospitals, medical technologies, and pharmaceuticals, unequal access to care has sparked ongoing controversy. A segment of the population still lives without health insurance, resulting in delayed medical attention or seeking care only when conditions have worsened. Health disparities are further magnified among different ethnic groups, income brackets, and geographical regions. Consequently, healthcare reform remains a deeply divisive political issue in the U.S., with continued debates over whether to expand government involvement or preserve the current market-based system. Several new models are being tested to improve insurance efficiency, including value-based care, where healthcare providers are rewarded for keeping patients healthy rather than for the volume of services delivered. Other alternatives such as short-term health plans, medical cost-sharing communities, and religious healthcare ministries have emerged as options in response to rising costs of traditional insurance. Overall, the U.S. health insurance system reflects both the strengths and weaknesses of a free market economy. It is efficient, competitive, and innovative, yet complicated, uneven, and often driven by profit motives. Americans must not only choose their doctors and hospitals, but also act as savvy consumers of insurance plans, understanding the fine print, coverage limits, and financial responsibilities. In an ideal world, health insurance would serve as a comprehensive safety net for all citizens. In reality, it often becomes a conditional privilege, where peace of mind comes with high costs and complex compromises that not everyone can easily afford.